Hello. Today our question is, within 1 minute of performing test in the image, a patient has a positive result. Which of the additional tests below is most appropriate to establish a firm diagnosis? Our answers are A, empty can test, B, cervical compression test / Sperling's test, C, Adson's test, or D, Tinel's sign. So, empty can test. Empty can test tests the supraspinatus tendon integrity. You have the patient in a 90-degree of scaption with thumbs facing downwards, and then the physical therapist applies a downward force on the wrist. We have the cervical compression test, or Sperling's test, and that test for cervical nerve root compression. Patient's neck is laterally flexed with slight extension, while the physical therapist applies downward force through the cranium, so this would be like for your radiculopathy. Then you have the Adson's test, and this tests for thoracic outlet syndrome. And so the patient's arm is abducted to 30 degrees and then fully extended, like in the photo below. The radial pulse is palpated while patient extends and turns head towards symptomatic shoulder and takes a deep breath. Then you have the Tinel's test, or Tinel's sign, and this is done by tapping or percussing on a nerve to evoke symptoms. And this has many uses. This can be used for carpal tunnel, cubital tunnel, tarsal tunnel, and a few other things as well. So, when we look at this picture, we see that the patient is performing Roos test, which helps rule out thoracic outlet syndrome. So therefore, that makes it pretty easy to narrow down what's going on. We know, though, however, that they had a positive result. So we need to be able to rule up or out thoracic outlet syndrome. Well, we know to establish a firm diagnosis, we'll need some additional tests. We know the patient had a positive result to the Roos test below, so we need an additional test to establish a firm diagnosis. When we look at this, well, the empty can test, like we talked about, is the supraspinatus integrity of the tendon. Cervical compression test, or Sperling's, is for cervical radiculopathy, mainly. And then you have the Tinel's test, which is tapping on a nerve, or the Adson's test, which is specifically for thoracic outlet syndrome. And so therefore, if you know the test, this makes it a pretty easy choice. It would be C, Adson's test.